Bienvenue, Karibuni, welcome, and Jambo to the Accountability on African SRHR Instruments online course. It is brought to you by Accountability International, the AIDS Foundation South Africa, and the Sex Rights Africa Network. In our previous module, we looked at global commitments. The four main ones were the ICPD, the Millennium Development Goals, the ICPD Beyond 2014, the SDGs, and the MAPUTO Protocol of Action. Today, we're going to examine and probably learn how to be able to identify the four most relevant global commitments on SRHR, but also be able to explain why these four commitments are relevant to African SRHR work. Our estimated time is 45 minutes. To start us off, we have what we call the minimum standards for HIV and AIDS, TB, hepatitis B and C, and sexually transmitted infections prevention, treatment, care, and support in prisons in the Sadek region. This commitment was developed in 2009 as a response to various drivers. Article 3 of the Southern African Development Region Protocol on Health demands that member states, quote, identify, promote, coordinate, and support activities which have the potential to improve the health of the Sadek population, and that they, quote, coordinate regional efforts on epidemic preparedness, mapping, prevention, control, and the eradication, where possible, of communicable and non-communicable diseases. The main purpose of the regional minimum standards, therefore, is to establish the minimum requirements for prisons to effectively prevent, treat, and control HIV and AIDS, TB, hepatitis B and C, and other STIs. The minimum standards also serve as a harmonization framework for responses to these communicable diseases across all Sadek prisons. Its relevance to SRHR, you may ask, is that it contains all kinds of requirements to help promote the SRHR for prisoners, such as prisoners and detainees, should be provided with information, education, and communication materials, behavior change communication, and other materials for the prevention of infectious diseases. Also, prison health services should provide education on how prisoners infected with HIV, TB, hepatitis B and C, or STIs can best manage their health. And of course, PMTC services for all pregnant, HIV-positive female prisoners and detainees according to national policies and guidelines. Another regional commitment is what we call Resolution 275. A bit of a background. Over the last years, there have been increased pressure from African lesbian, gay, bisexual, trans, and intersex activists to recognize same-sex relations, human rights, dignity, and respect for Africans who are sexually diverse. Resolution 275 is a commitment by Africa's highest human rights body, the African Commission on Human and People's Rights, on the protection against violence and other human rights violations against persons on the basis of their real or imputed sexual orientation or gender identity, which was adopted at the 55th Ordinary Session in Angola in 2014. The main objective of Resolution 275 are four. 1. It aims to deeply disturbed by the failure of law enforcement agencies to diligently investigate and prosecute perpetrators of violence and other human rights violations targeting persons on the basis of their imputed or real sexual orientation or gender identity. 2. Condemns the increased incidences of violence and other human rights violations, including murder, rape, assault, arbitrary imprisonment, and other forms of persecutions of persons based on their real or imputed sexual orientation or gender identity. 3. Specifically condemns the situations of systematic attacks by state and non-state actors against persons on the basis of their real or imputed sexual orientation or gender identity. 4. Calls on state parties to ensure that human rights defenders work in an enabling environment that is free of stigma, reprisals, or criminal prosecution as a result of their human rights protection activities, including the rights of sexual minorities. And 5th, strongly urges states to end all acts of violence and abuse, whether committed by state or non-state actors, including by enacting and effectively applying appropriate laws prohibiting and punishing all forms of violence against those targeting persons on the basis of their imputed or real sexual orientation or gender identities, ensuring proper investigation and diligent prosecution of all perpetrators, and establishing judicial procedures responsive to the needs of victims. You may ask, what then is the relevance of Resolution 275 to SRHR? The resolution is a major step and the most powerful Pan-African LGBT commitment. It will give them better protection within the community, but also in healthcare settings, so that they can access the services they need. Moving on, we come to the Sadek Regional Strategy for HIV Prevention, Treatment and Care, and Sexual and Reproductive Health and Rights among Key Populations. As a result of a series of consultations that took place several years ago, the Sadek Regional Strategy for HIV Prevention, Treatment and Care, and Sexual and Reproductive Health and Rights among Key Populations was finalized in October 2017. The strategy is based on a few guiding principles. 1. Fundamental rights for all persons. 2. Political commitment is a necessity to ensure universal access. 3. Effective partnerships are necessary between governments, civil society, key populations, and the private sector. 4. Respect for diversity is paramount and is reflected in the strategy. 5. Participation, inclusion, and equity. Key populations should be included, and the allocation of resources to ensure ongoing participations are vital. 6. Evidence-informed programs of the highest standards are key to achieving the strategy's goals, and these programs must be based on evidence. And of course, 7, do no harm. No member of a key population group should be in any way put at risk of harm in the development and implementation of the strategy. The 4 outcomes or key results areas of the strategy are: 1. Stigma and discrimination against key populations, particularly at service provision points, is eliminated. 2. Violence against key populations is significantly reduced. 3. SRH and HIV prevention, treatment and care, and support programs are scaled up for key populations and especially young persons as per the core package of services and are evidence-informed and results-oriented. And of course, 4, a reduction in the legal policy and cultural barriers which impede key populations' access to HIV and SRHR services. The long-term aim of the regional strategy is: 1. Increase or ensure availability of SRH and HIV prevention, treatment and care services to all key populations within the Sadek region. 2. Design and implement holistic strategies covering the policy, legal, institution, and facility level in the Sadek region. 3. Increase access to quality and comprehensive HIV and SRH services for key populations in all member states, such that 90% of members of key populations are accessing services. And 4th, ensure adequate and sustainable resource mobilization and utilization for HIV and SRH services for key populations. The diagram shows the development process of the Sadek Regional Strategy for HIV prevention, treatment and care, and SRHR among key populations. In November 2018, the Southern Africa Development Community's Regional Strategy for Sexual and Reproductive Health and Rights 2019-2030 and scorecard was approved by the Southern African Ministers of Health and/or HIV and AIDS. The purpose of the strategy is to provide a policy and programming framework for member states to accelerate the attainment of sexual and reproductive health and rights for all people living in Sadek. The strategy is deeply linked to the following: the ICPD framework, the SDGs, the 2016 Political Declaration on HIV and AIDS, the MAPUTO Plan of Action of 2016 and 2030, the Sadek SRHR strategy, among others. The commitment is one which has a broad beneficiary base, making it one of the best commitments to SRHR globally. Beneficiaries include adolescent girls and young women, women of our productive age, men and boys, key populations including sex workers, people who inject and use drugs, prisoners, MSM and LGBTIQ, migrants, refugees, mobile populations, people living with disabilities, and victims of sexual exploitation. 4 core strategies to drive progress to achieve the 10 outcomes are proposed as follows. 1. Innovative leadership that boldly accelerates the SRHR regional agenda. 2. Alignment of member states' policy and legal frameworks with the global and regional commitments and international human rights standard. 3. Universal health coverage and strengthened health system in member states to incorporate the essential SRHR package. And of course, 4. Monitoring and evaluation for the strengthened evidence-based impact. 3. Universal health coverage and strengthened health system in member states to incorporate the essential SRHR package. And of course, 4. Monitoring and evaluation for the strengthened evidence-based impact. We now come to Agenda 2063. In May 2013, Africa's plan for the next 50 years was agreed upon by the African Union and expressed through the document called Agenda 2063. Agenda 2063 is a strategic framework for the socio-economic transformation of the continent over the next 50 years. It builds on and seeks to accelerate the implementation of past and existing continental initiatives for growth and sustainable development. The agenda consists of 7 aspirations for the African people and its diaspora. 1. A prosperous Africa based on inclusive growth and sustainable development. 2. An integrated continent, politically united, based on the ideals of Pan-Africanism and the vision of Africa's Renaissance. 3. An Africa of good governance, democracy, respect for human rights, justice and the rule of law. 4. A peaceful and secure Africa. 5. Africa with a strong cultural identity, common heritage, values and ethics. 6. An Africa whose development is people-driven, relying on the potential offered by people, especially its women and youth, and caring for children. And finally, an Africa as a strong, united, resilient, and influential global player and partner. Agenda's 2063 main objectives are to identify priority areas, set specific targets, define strategies and policy measures required to implement the first 10-year plan of Agenda 2063. It also aims to bring to fruition of the fast-track programs and initiatives outlined in the Malabo decisions of the AU to provide the big push and breakthroughs for Africa's economic and social transformation. It also aims to provide information on all key stakeholders' engagement at the national, regional and continental levels, the expected results and outcomes of the first 10 years and the roles. 4. It also aims to assign responsibilities to all stakeholders in the implementation, monitoring and evaluation. Finally, to outline the strategies required to ensure availability of resources and capacities, together with the citizens' engagement in the implementation of the first 10-year plan. You may ask, its relevance to SRHR? There are not yet direct concrete actions related to SRHR, but the underlying principles like respect for human rights will also include SRHR. If the process is more bottom-up, it means that people are essential and they can demand their rights and use their capacity to fulfill their rights. The MAPUTO Plan of Action aimed to achieve universal SRHR in Africa by 2015. The whole MAPUTO Plan of Action is related to SRHR, as can be demonstrated in the table on your right. We now focus on the catalytic framework on HIV, TB, and malaria. A bit of a background. The African continent has made significant progress in responding to AIDS, TB, and malaria since the 2000 ABUJA Declaration on rollback malaria and the 2001 ABUJA Declaration on HIV and AIDS, tuberculosis, and other related infectious diseases. Its main objective were to end AIDS and tuberculosis and eliminate malaria in Africa by 2030, with specific objectives of each element. 1. To eliminate malaria incidence and mortality, prevent its transmission and reestablishment of all countries by 2030. To end the AIDS as a public health threat by 2030. To end TB deaths and cases by 2030. Its relevance to SRHR? The framework does not have specific talks about SRHR, but it supports different conditions to support access to SRHR. We now come to the MAPUTO Protocol. The MAPUTO Protocol was originally adopted by the Assembly of the African Union in Maputo, Mozambique, on July 11, 2003. The main objective of MAPUTO Protocol aimed to have the ability to change harmful vices such as gender inequality and disadvantages of women in Africa. Its relevance to SRHR? State parties shall ensure that the right to the health of women, including SRHR, are respected and promoted. And of course, we focus on the ratification of the MAPUTO Protocol. The African Charter on Human and People's Rights on the Rights of Women in Africa, Declaration also known as the MAPUTO Protocol, is a key document for women's rights in Africa, as it addresses several issues that pertain to women's SRHR and matters such as elimination of harmful traditional practices, the right to dignity, the right to education, and reproductive health. We now come to the Addis Ababa Declaration on Population and Development in Africa beyond 2014. The Addis Ababa Declaration was set up by representatives of government, multilateral agencies, development partners, civil society, professional associations, education, training, and research institutions, care and support organizations, and people living with HIV and AIDS in a meeting in January 2008 to address the human resource constraints that were impeding progress towards the realization of the Millennium Development Goals to reduce child mortality, Goal 4, to improve maternal health, Goal 5, to combat HIV and AIDS, malaria and other diseases, Goal 6, and towards achieving universal access to HIV and AIDS services by 2010. The main objective of the Addis Ababa Declaration are to move forward the agenda to reach the MDG by 2010, that task shifting is needed as a response to health workforce shortages, as well as health systems need, is being implemented in different ways into a variety of extent in many countries, often informally. Its relevance to SRHR? All MDGs 4, 5, and 6 are related to SRHR for all people. They acknowledge that there is an urgent need for rapid increases in access to essential health services, especially for the poor, and that improvements in the performance of health systems, including significant strengthening of human resources for health, are necessary to deliver services which are accessible, safe, efficient, effective, equitable, and sustainable. We will now focus on the ABUJA Declaration and the Africa Scorecard on Domestic Financing for Health of 2018. In 2001, African heads of state met and guaranteed to set a target of at least 15% of their annual budgets in order to improve the health sector. It was also during this time that they urged donor countries to, quote, fulfill the yet-to-be-met target of 0.7 of their GNP as official development assistance to developing countries. This became known as the ABUJA Declaration, end of quote. The primary goal of the ABUJA Declaration is to arrest and reverse the accelerating rate of HIV infections, TB, and other diseases. Its relevance to SRHR? The priority areas of the framework were related to improvement of information, education and communication, protection of human rights, including enacting relevant legislation to protect the rights of people infected and affected by HIV and AIDS and TB, strengthening existing legislation to address human rights violations and gender inequalities, and respect and protect the rights of infected and affected people, and finally to assist women in taking appropriate decisions to protect themselves against HIV and AIDS. We now come to the African Union Roadmap on harnessing the demographic dividend. A bit of a background. To effectively implement the African Union Assembly decision of January 2016, to devote the theme of the year 2017 to harnessing the demographic dividend through investments in youth, African heads of state and government requested the Commission, in collaboration with other stakeholders, to develop a roadmap with key deliverables and milestones to guide member states and the regional economic communities on concrete actions to be undertaken in 2017 and beyond. Investments made today in the youth, who represent Africa's greatest asset, will determine the development trajectory of Africa over the next 50 years and position the continent towards realizing the Africa we want, a strong, united, and influential global player and partner as envisioned in Agenda 2063. The overall objective of the roadmap is to guide and facilitate the implementation of the theme of the year 2017 by member states, regional economic commissions, and partners through key deliverables, milestones, and concrete actions as stated by the Assembly's decision. Its relevance to SRHR? One of the thematic pillars is health and well-being, which includes establish and promote integrated adolescent and youth-friendly health services in public and private health facilities, school clinics and other venues, with adequate services for SRHR. Also, prioritize national investments to ensure universal access to family planning services, including expanding the use of modern contraceptives, as stated in the extended MAPUTO Plan of Action on SRHR of 2016 to 2030. Finally, we come to the ministerial commitment on comprehensive sexuality education and SRHR for adolescents and young people in Eastern and Southern Africa. A bit of a background. In response to the projected growth of young people aged 10 to 24 years in Eastern and Southern Africa, from 158 million to 281 million by 2050, and the impact of SRHR services on young people, 21 countries in the region came together to affirm their commitment to providing comprehensive sexuality education and sexual and reproductive health services to adolescents and young people. The main objective of the ministerial commitment on comprehensive sexuality and SRH has had as one of its targets for the end of 2015 the establishment and implementation of a good quality CSC curriculum in each country. Relevance to SRHR. The EAC commitment has, in many countries, acted as a catalyst for action regarding scaling up comprehensive sexuality education. And with that, you come to an end. However, you can be able to assess yourself and identify the 4 most important global commitments on SRHR, what each of the commitments' objectives are, and what objective do these commitments have all in common. For more information or additional information, please do not hesitate to get back to us. Thank you very much.